The brain needs a cleansing of all these chemicals in our diet today, right? And no matter what it is, your brain has to clean itself up. And deep sleep is the cycle that gives that. But again, the brain doesn't know a good habit from a bad habit. It does not know the difference. It only knows the habit. So whatever habit you put in is what it does. So whatever sleeping disorder shows up on the test, it can be a mechanical problem, or maybe your airways blocked some way, or it can be a physiological, psychological problem, which is a different treatment, which is what I call cognitive behavioral therapy for insomnia. Well, when you have sleep disorders, those hormones can be inverted. You can have ghrelin in the morning, in the night, and you can have leptin in the morning. So if you're hungry at night, the ghrelin hormone is active. And if you're not hungry in the morning, when you got up, your leptin hormone is active. Because you're supposed to eat in the morning. You're supposed to be hungry all night. People get anxious about their divorce or their separation, and they eat. They watch their videos, they watch their TV, whatever it is, and their whole circadian rhythms change, so their hormone levels of eating have changed. And they can't control it anymore. And they want to control it, but they can't. It's not their fault.
Welcome to the Just Separated podcast. Hi, I'm Karen Oman, a thanatologist, grief counselor, divorce strategist, and co-author of the Just Separated workbook. I draw on years of personal and professional experience to guide you through the challenges of your divorce. Together, with our expert guests, we'll equip you with the clarity, resilience, and tools to take charge and move forward with confidence. Follow Just Separated and join us as we explore the many different facets of divorce. This is part 2 of our podcast series with Dr. Todd on sleep and divorce. In this episode, we'll be sharing practical tips to help you get a better night's sleep as you navigate this challenging chapter.
So what happens is, in the morning, when somebody gets up, we want people to, in our practice, we want people to limit the amount of caffeine they take. Because if you want to know something that hurts you physically, it's caffeine. Because caffeine grabs hold of the receptors and creates an excitatory event for you and keeps you awake and then keeps you going and increases your heart rate and becomes permanently fixed over time. So you get high blood pressure. You know that. Everybody takes coffee for a long time. And when people get stressed, they sip on coffee because it tastes good and it's part of their habit anyway, and they may drink more of it. But we use anandamide. We use a product, what's that called? It's not R&R. We have a night cannabinoid. We have another one. And anyway, it's a morning product. And what we do, we try to have people reduce the amount of caffeine they're taking by taking this anandamide, because anandamide wakes you up. It gets you up in the morning. It's the natural chemical that starts your day. And so you want to have something that's natural to start your day and doesn't hang around all night and drive up your blood pressure, which caffeine does. So it's not a caffeine supplement, meaning that my patients, coffee's coffee. You can't break a coffee habit hardly with anybody. It's just a wonderful drink. I have a half a cup in the morning. It's about 80 milligrams of caffeine. But people don't, in our society today, caffeine is over in almost everything, right? It's infused in almost every drink, coffees, drinks, carbonated drinks, whatever. And that caffeine is just devastating for sleep. So we use cannabinoids, CBD, this technology, to be able to have people modulate the amount of caffeine they're taking.
With this, I can just see the cycle. Like you're going through a crisis, divorce or whatever, and you're just short sleeping, you call it.
Mm-hmm.
And you're waking up, you're eating terribly, right? Because that's a habit too, right? Because you're like grabbing for things that you probably wouldn't have not grabbed because you're so tired, and you're just drinking coffee and coffee and coffee. So what I'm hearing you say is, if you do the melatonin at night, if you wake up stressed, which you can in these situations, it can help you put you back to sleep.
Yeah.
And then you would take the drips in the morning to help
Yeah,
you.
you take the cannabinoid in the morning so that it reduces your anxiety, which helps reduce the amount of caffeine. So one of the things that that CBD does, and other products like it. Now we don't. Again, I'm a clinical cannabinologist too, which means I use THC, CBD, CB, and all these cannabinoids in different manners for different patients, for different scenarios. Everybody's different. And so, but CBD, and there are three cannabinoids that work well together uh, to help you bring you awake in the morning and to get you going. That's CBD, which you heard about. Then there's another one called CBG, and then there's a third one called CBC. And these three cannabinoids, when they're put together, allow you to increase your cognitive ability in the day, help settle your tummy down, because once you're anxious and nervous, your tummy really gets upset. People have cramps and tummy aches, things of that nature. And then the CBD helps with just overall dilation of the blood flow of the brain to allow clarity. So we use that product, and I cannot think of the name of it. Jenny comes back in here, I'll ask her. For morning and daytime. So you take that in the morning with that combination, then you take it again at lunch if you need another boost of it. Some people just need it in the morning. But these are all natural, and the reason that's important is because everything that we do, everything we eat, everything we drink, everything that has a chemical in it gets to the brain. And it stays in the brain all day. Okay, even these chemicals, melatonin, CBC, CBD, CBG. And you have to clean the brain every night. Not every other night, not every third night, not when you short sleep, you don't do that. You don't clean the brain. So the brain needs a cleansing, just like I'm going to go out and clean the inside of my car here in a little bit because it's pretty trash and I don't like that. So, but my point is that the brain needs a cleansing of all these chemicals in our diet today, right? And no matter what it is, your brain has to clean itself up. And deep sleep is the cycle that gives that. So when you go through deep sleep, the brain produces signals, the body of the brain, to produce more cerebral spinal fluid. It's called the gliophatic system. The gliophatic system cleans the brain. It's a washing machine of the brain. And that goes on during deep sleep. So that washing goes on. And then what happens is you get up and you pee. And you get rid of it the next day. Now, if you snore or have apnea, you'll pee more than once at night, which is not a good thing. You're only supposed to get up about once at night and pee. So that's another whole talk, but that's part of what happens to us when we short sleep. And people say, well, that's, I can get that done. How long can you go with that chemical accumulation in the brain? What's number one?
What are the effects, long-term effects on that, Dr. Todd, if you short sleep and don't deal with this?
Alzheimer's and dementia.
So that's
Yeah, that's the two. How much do you read about those? Quite a bit, right? Why Alzheimer's and dementia is at highs? Because it's a great time of short sleepers. And the research supports that. Research supports that almost all Alzheimer's patients, dementia patients, were short sleepers. They didn't sleep well as children. They didn't even sleep well as adults. They carried over bad habits throughout their lifetime. That's the end result. And that's where we're headed, even with children.
Really?
Mm-hmm.
Yeah, well, I think about that with the cell phones in their rooms or the habits that are not implemented, right? Because aren't habits of sleep like really important?
Yeah, sleep is habitual. I mean, it's you learn how to snug your pillow, like we talked about. You learn how to tuck it under between your legs and pull your leg out and put your pajamas on. All that is a habitual part of going to sleep and getting comfortable with it. But again, the brain doesn't know a good habit from a bad habit. It does not know the difference. It only knows the habit. So whatever habit you put in is what it does. It does not distinguish at all. So it's your habits, whatever they are, that dictates what you do.
Can you give the listeners like one tip to break the habit? Like not like the melatonin, but like maybe more
Yeah.
of a educational thing?
Yeah, there are a lot of educational things. Now, this is where what sleep specialists do
Mm-hmm.
that a lot of people try to do on their own. Some people are successful in managing their own sleep. They'll get themselves back into a regular sleep cycles. Some people aren't. So, from a sleep standpoint, um, there are different things you can do. It depends on a sleep test. You have to diagnose sleep with a test. It can't be diagnosed with me just guessing about it. So one of the things that's misunderstood, and about a very, very small percentage of the population does sleep testing, has a sleep test done, right? I mean, we've been doing them for years. Rare, I mean, I'll do, one or two, three a week of the whole population, right? Well, insurance doesn't recognize those sleep tests like they do a blood test. Back to money. So they're like $300, $325 to do a sleep test. The data that comes off of that shows what to do. No one knows what they do when they're asleep, and I can't guess. Well, what'd you do in your sleep? I don't know. Nobody knows, right? You just do not know. So the data from a sleep test is super important in figuring out what's going on with the patient during their sleep cycles and during their sleep stage, during everything. And that's not been well known. That isn't well known. What is well known about sleep is that right now, and you don't have to do this anymore, but you used to have to go to a lab to sleep overnight, 2 nights, that kind of thing. And they always wanted to give you a CPAP device or an APAP device, which is a device, you would get treated. You're going to have apneic events. That's a sleep disorder and blah, and you get this thing. And that's sort of the standard of care that was established for the last 30 years in sleep. And that's all really anybody knows about it. But in our profession, I'm an integrative sleep specialist. So what that is I do that part of it, but I do also, and since my background was in dental surgery and anesthesia lends itself to sleep, and dental lends itself to I can make an oral appliance that also can help sleep. And then the third part of it is called cognitive behavioral therapy for insomnia. And that's the psychological impact of sleep. So whatever sleeping disorder shows up on the test, it can be a mechanical problem, or maybe your airway's blocked some way, or it can be a physiological or psychological problem, which is a different treatment, which is what I call cognitive behavioral therapy for insomnia. But it is a very integrative type of therapy for CBTI is with me, because I integrate lots of different protocols for it. I don't always know which one's going to work best. So we just hammer it with everything we got. So we use audio files. I've created a set of audio files that you listen to, and they change the brain waves. So that's one way. We use the drops we talked about. We use a breathing re-education system that I've been using for years to help people change their breathing. It's easy to say, it's hard to do, right? When stress comes on, you slow your breathing down. Who knows what kind of breathing? Well, I do, but my point is that happens. The newer way also is because a lot of people that have sleeping issues, whatever it is, have a weight problem too. And that's a very common thing. You have you're sleep deprived and you gain weight. And we talked about this previously, but I'd like to comment on it. When you have sleeping issues, whether it be sleep deprivation, short sleeping, apnea, whatever it is, the two hormones that are regulated with circadian rhythm is leptin and ghrelin, two weight controlling hormones. And these hormones are controlled with the sun. So as the sun goes down, there's a hormone called leptin that is produced by the brain by anandamide. Anandamide lets it go, leptin starts being produced, and you don't get hungry. So your appetite is down. You're not hungry. And then as the sun comes up, the same thing happens, anandamide levels rise, the ghrelin eating hormone rises, and you get hungry. You're ready to eat breakfast. I'm ready. That's how that came about. Well, when you have sleep disorders, those hormones can be inverted. You can have ghrelin in the morning, in the night, and you can have leptin in the morning. So if you're hungry at night, the ghrelin hormone is active. And if you're not hungry in the morning, when you got up, your leptin hormone is active. Because you're supposed to eat in the morning. You're supposed to be hungry all night. And that's easily mixed up. Very, very simple process that's out of control in society, right? It's out of control. People get anxious about their divorce or their separation, and they eat. They watch their videos, they watch their TV, whatever it is, and their whole circadian rhythms change, so their hormone levels of eating have changed. And they can't control it anymore. And they want to control it, but they can't. It's not their fault. One thing I think about the people you work with is it's life. It's just life. Good or bad, it's life. And people do a lot of self-blaming, on this. And that's the furthest thing from having a way to help it, right, is blaming it. So one of the protocols in what I do is called self-talk. And so I have a protocol for that, and I have a system for that. So people talk to themselves the way that, and self-talk is devastating. Okay, devastating. It'll gut you in a heartbeat. So the self-talk that we use for sleep is a daytime self-talk designed to give you the correct self-talk for daytime. And then we have a audio system for nighttime. So you're never without somebody telling you your right self-talk, your correct way that you should hear you talk to you. Not what I would say, not what you would say, what you would say to you. And that helps set these hormone levels also. So because that's you talking to you in the most friendly, poignant manner. And that helps the brain relax and gets these things set correctly. But on the other part of that, some of that is impossible to do even with all that being done with weight loss. So there's been a breakthrough in the last couple of years in weight loss with these new class of drugs called GLP-1 drugs. And they are weight loss. They were created for diabetics. And, they could give yourself a little diabetes shot in the tummy. And they've really done well. I've done a lot of research on them and talked to the companies, and they're a really good product. Now, they're hard to get right now, very hard to get. Insurance won't pay for it. I don't know about Canadian insurance. I don't know anything about that. I just know, but it does give you a method to lose weight safely. However, if you use GLP-1 drugs and you have a prescription for them, and then you stop using them, if you don't have a cognitive method in place to supplement with, you just gain the weight back. So that's why cognitive behavioral therapy for insomnia is important with the GLP-1, because it gives you a method, a system to keep the weight off by increasing your sleep. Because good sleep will help you reduce the weight. GLP-1 helps you get it off, but you need good sleep to keep it off and get the hormone levels set. Does that make sense?
It makes perfect sense.
Make how sense?
It makes perfect sense. It's like
too in the weeds.
Yeah, it sounds like this. For people who are really struggling sleeping, weight wise because of this, or divorce, or grief, or whatever.
Grief, yeah.
If they're really struggling, I mean, they need to see someone like you. Period. Right? Because they have to realize it's twofold, right? It's also, you need to change the mindset, do the CBT, as well as you may need the medicines like the
Yeah.
melatonin or even something stronger.
Yes.
But as you said at the beginning, like you can get on some stronger stuff at the beginning because, as you say, your body needs something to sleep,
Right.
right? But I guess what you're saying is you can't, it's not a quick fix. Like you go on any medication, you need to work on the mental side.
Yeah, and everybody, and we all know this. Everybody wants a quick fix in today's society, and that's just the way we're built because we have to get things done quickly. You can't spend weeks doing things, whatever it is. You want to get it fixed. So I won't say that there's not a quick fix for sleep disorders, but there has to be a protocol to get through it. There has to be a way. It has to be a method, and those methods, which I have done for years and perfected. Some of them, some people gravitate to them quickly and make changes fast. Some people don't. As a rule, a good habit, psychological habit, takes about 21 days to switch it. So it takes about 3 weeks to get a good habit in place that the brain says, okay, I like this. I'm going to keep doing this. But it's about 21 days that it takes to flip a habit of any type. So if that's quick for you, that's great. If it's not, okay, that's a long time. I mean, I can't, everybody's a little different. So, but in 21 days, a lot of people can backslide, because it's not quick enough for them. Now, I'm not saying the treatment takes 21 days, but habitually the brain says a habit being embedded in through neuroplasticity where the brain changes takes about 21 days. That's a proven scientific deal on habits. They proved that out many years ago. But for some people today, that's not fast enough, right? 21 days. Well, I don't know. I didn't make that rule up. That's just the brain doing its thing. But everybody can change. The brain changes through life. So we used to be taught that the brain won't change, can't change, shouldn't change, whatever. And that's been debunked now. The brain can change all the time. It changes all the time. And so with the right situations, the brain changes faster. And that's what my protocols are set up to do, is help the brain move faster along in this area with all these brainwave changes and all this stuff. Because sometimes people just can't make that shift. No matter how much they try, they can't. A good example of that, like you think one of your questions, you said, you wake up at 3 a.m. We talked about that. And that's a brainwave shift when you go to sleep at night. When you go to sleep at night, you're in this light sleep for quite a while. It's called hypnagogic sleep. And what that means is that, you can sort of hear noises and maybe hear people walking, and that kind of thing. But it doesn't really make any sense to you, but and then you slide on into sleep. Light sleep is not sleep. It's not restful. And so, but the brain during this light sleep phase, it goes on quite a bit at night. It starts in a wavelength called beta. And beta wave is the way you and I are engaging right now. We're talking the brain. If we did an EEG on your brain and looked at it, it would be in beta wave. And that's how we communicate. That's how we walk. That's how we talk. If you're sick, the brain makes another change in a gamma wavelength that shows a sick brain, sick wavelength. But that's another whole thing. But what happens is when the sun goes down, if the sun goes down in your house, or if you have all these things we've talked about, then the brain makes a shift from beta, which is engaging, to an alpha wavelength that's less engaging, to another wavelength called theta, which is even less engaging, and then finally into delta wave sleep, which everybody knows about, which is that deep sleep cycle where it's non-engaging. And then that happens every night, and then you shift out of that delta back into alpha, back into theta, and back into beta again to begin your next day. And you do that every single day. Well, what happens is when stress hits, like with your clients and people that then what happens is they don't make that brainwave shift out of beta completely, and they may pop back into it at 3 o'clock in the morning because they really never got out of it. They didn't get into that deep wave sleep. And if they did, maybe there's some residuals in there that just gets reactivated. and it wakes them up. So they're not really in that deep, restful sleep. If we've talked about this whole talk completely, they're just not in it. So the beta waves get to them and they wake up. That's about it. Does that make sense?
Yeah, it makes a lot of sense, and this awareness that I hope people listen to this whole podcast, because I had no idea, right? Like, we're not really, as I said, I've been frustrated with the lack of, like, of society, and right, we've talked about that already. But if people can understand this, um, awareness is the first thing you can do with
Yeah,
anything, right?
exactly.
Educate yourself, and now that you've talked about and you've educated yourself, and now they even they know you're available to talk to or to get a consult with. I just want to ask a question about, um is are there any ones that you see, like, can everybody go to you, or are there ones that particularly, like, you would go, you need me, like, like any symptoms that would come up
Well,
more, or
what we do to make this easy for people, because that's sort of where we're at with it, is we do this sleep test as a diagnostic test, and we mail it anywhere in the U.S. I think it can be mailed to Canada. So I think it has to be something has to be done here in the at home, so that it works someplace else. But it's a really good company, and the home sleep test we use pretty much can eliminate a lab test, but it's not designed to all the time. If you got to have a lab test, you get one done, and then the data comes to us. We look at it. I have a third party interpret that data, and then we have a consultation with anybody anywhere about what's going on with them. That's usually maybe an hour minimum. We mail the home test to people. They get the test done. Again, very few people ever get one done, and then the data comes back to us. It's all done Bluetooth, so you don't even have to mail the test back. It's a one and done deal. And then that comes back, and then we also get it interpreted by somebody else. So there's not just me. And then we get it interpreted. Then we do a consultation. It usually lasts an hour, like we're doing here. And then from that, we design treatment plans out of that. And the only one that anybody has to come to the office for is for if they have a sleep disorder, special type, maybe some type of sleep disorder where they need an oral appliance or something to wear, and they can't wear CPAP, something like that. That's the only time they have to come to my office to get molds. You can't do that any other way. If you did, I'd be suspect it would work. So you just take the molds and the bite, and they make a trip to see me on that. And then if they can't make a trip back, then we can mail it to them. But I'd prefer to make a trip in to put it and make it fit. So that's the only scenario where we can't do it via Zoom, or if the diagnostics tests tell us that, okay, CBTI can be done on Zoom. We do this all the time. So I have a toolkit with this. And so we mail the toolkit off to the patient and get them ready. They get the toolkit, and then we do the CBTI over the Zoom. Usually takes a couple of visits. And I do that face-to-face too, but it's not necessary to do it face-to-face. So the only part of it, and I can even deliver the APAPs via the mailing too, based on the data from the sleep test. So that you don't even have to show up for that one either, because I can just mail a CPAP or an APAP, whatever is necessary once the testing's done. But that's a mechanical problem, and what we're talking about are psychological problems, right? That's where CBTI comes in. Almost all of that can be done via Zoom, once I get to know the patient. But you always have to do the sleep test. You cannot move forward in sleep without a sleep test. I can't guess what you did at night when you were asleep.
yeah, that makes perfect sense. I
Yeah,
mean, they can tell you, but we don't even know what we're doing when we're sleeping, right?
no, no. I have people all the time tell me, I sleep on my back all night. Oh, yeah, well, the test shows you're on your right side 80% of the night. They don't know that. You don't know where you're at. So the test is always what needs to be done. We can mail that anywhere in the world, in the U.S. I don't say the world because I'm not sure if the technology works in Guatemala, or what I mean, or something like that. But I think U.S. I know U.S. and I think Canada too, because the company is a global company. called,
I don't think it would be a problem.
yeah, it's ResMed. It's the largest. Well, it's not ResMed doesn't make the sleep test, but the company is a very very solid sleep test company. And that's another thing about testing. Testing sometimes in the pace at which this sleep is evolving, um, there are tests that aren't very good, home tests that are not very good, meaning that they don't get the data that we need. Not that they're bad tests, just they're not good enough to get data that we need to be able to look at the sleep like we need to look at it. So that's why I use the brand that I use, which is a company called Zoll, Zoll. And they have excellent data, and we do cardiac studies on that data too. So there's more to it than sleep. A lot of the issues show up cardiovascularly before they show up someplace else. So we see with these testing, um, we see people who have, elevated pulse rate arrhythmia, uh, hypertension due to um, irregular pulse rates, beating. We see conduction problems with the heart, where there may be an AFib quite a few times at night when they're anxious. And then they wonder why their chest hurts when they get up in the morning. You heard everybody say that. I get up in the morning, man, my chest just feels like it's hurting. I slept all night. And that could be an AFib. They could just have elevated heart rate, arrhythmia, making their heart pound real hard. And then another problem with people is that they snore. About half the population snores, and that's made fun of. Particularly women. Women have a hard time coming forward with that more than men. And snoring is more than just a noise. What it does is when you snore, you vibrate the upper chest cavity. And then what happens is the upper chest cavity is connected to the heart sac, pericardial heart, the heart sets in. And that upper chest cavity irritates the heck out of that chamber of that heart. And so that causes the heart rate to go up, and it also causes you to hyperventilate, and then it also causes you to dump fluids. So a lot of people have to get up and go to the bathroom a lot to snore. And it's just the snoring, not all this other stuff we talked about.
Mm-hmm.
Just the snoring alone, no other issue, causes all that. But people, as a rule, how seriously, if you have a client that is stressing, does anybody ever ask them, well, do you snore? Never, ever. So what's the quality of their sleep? Poor. It's never asked. So, that's the kind of things that are under the radar with sleep. Does that make sense?
Oh, it makes a lot of sense.
Yeah.
I'm just learning. I'm just still like I've talked to you. I think this is my third time, and I'm still like absorbing more things that you're teaching because and I think I'm a pretty educated person, and I'm still going, wow, like it's as again, like there's so not enough awareness about this, right? Before
Um,
we before we wrap up, I want to ask questions. Why did you decide to do this field? Like,
well, you saw what I did in my background.
mm,
I've been around for a while, and I've done all kinds of different things and had all kinds of different specialties and boards and all that kind of stuff. And as an anesthesiologist back in the day, I was a dental anesthesiologist. I intubated in the throat, in the head and neck, but I worked on the dental environment. I noticed a lot of undiagnosed sleep problems. So I would put somebody to sleep and they would have all kinds of sleeping issues, either waking up or not waking up or coding on me or whatever, right? And I went, this will get your attention. It gets your attention really fast. This is a long time ago. So when I retired from that back in 2014, I said, well, what, I sat around a few years and I said, well, what can I do that can help people differently, but also, it's all I've known my whole life is healthcare. I've never done anything else. So, I said, maybe focusing on sleep, being a sleep specialist, taking all this training that I've had and focusing on just sleep and these different parameters of sleep is what I'll do. And it's been 10 years and that's what I've done.
Yeah, I love the work you do, Dr.
Thank you.
Todd. I think that, as I said many times, the world needs more of this information out there.
Well, you're
Carrie.
doing your part. You're doing your part with the podcast. I mean, I can tell a few patients because my wife and I have a mom and pop business. I mean, we're small and by design. I'm not trying to build a big, multifaceted clinic, running in and out of the rooms. I'm just not doing that. I did that and I'm not doing that. I just enjoy taking people. If somebody calls me on a Zoom, it's just me and them, right? I don't have 5 other people on that Zoom at the same time. So that to me is important in finding in knowing sleep. But I only tell a few people. You tell thousands of people. That's the difference, right? I reach a person here and there. You're reaching, I don't know, how big is your audience?
Oh, it's decent size.
Yeah,
That's good.
yeah,
Yeah.
it's a decent size. So you're impacting many more people. I tell photographers this all the time. I'm on the Blue Angels. I don't know if you heard of them. They're the Navy flight demonstration team here in Pensacola, and I volunteer with them. And so I tell the photographers all the time. I can tell a few people about the Blue Angels. You can tell thousands with your video, with your shots, your photography, and that's the impact you have. Because you're telling people about things that I could not tell anybody because you took the time to connect us. So I applaud you for that.
Yeah, again, I think it's just a very important topic.
Thank you.
I think it's a very, but before we go, I always ask my guests the last question before you can tell me where to get in touch with you and stuff. We've talked about this already, but let's just wrap it up. But for someone who's just separated, whether they left or were left, what advice would you give them to help them navigate those overwhelming early days? So,
Well, I think stick to their cycles. Stick to their getting that good 6 to 8 hours sleep. If you when that stress hits, whether you have to do it with medication or and on the short term, and then find a way through either a sleep specialist or some other way to maintain that sleep. So that you can make those decisions that are life decisions that are coming at you left and right on a clear mind. Does that make sense?
yeah, brilliant. Hmm.
And so don't try to get 2 to 3 hours sleep here, then stick with it. You know, I have patients, and I wrap it up too, but I've had patients that are well into their hundreds. Okay. And the one thing they've always done, they go to bed when they're supposed to and they get up when they're supposed to without an alarm clock. And they've done it their whole life. And they've lived well into the hundreds healthy. You know what I mean? Now and a lot of them have gone through divorces. They're not free of that, but they maintain their sleep. They made a commitment to it.
Great answer and great advice. So, where do they get in touch with you, Dr. Todd?
Well, I have a website called GulfCoastSleepSpecialist.com that they can go to and check me out. And then we have a phone number on there. It's 251-284-5332 is our U.S. number. And they can call, just set up a Zoom. We like to do Zooms. I like to see people. So we like to do Zooms. And that starts it off. And then from there we go, well, do you want a sleep test or whatever? And I'll do a free consultation for about 15 minutes or so. People just want to talk a few minutes, that's fine. But like anything, it's expertise, so you got to pay for it eventually, you know.
Yep.
So,
That's
but
right.
eventually, but I like people to engage, that way, because it's baby steps. People don't know about sleep, and just taking baby steps, with people.
Well, thank you very much for coming on.
Well,
Even
thank
this
you for having me,
podcast,
Karen.
yeah, this podcast it's gonna taught me a lot. It's gonna teach a lot of people a lot. So,
Sure.
thank you to Jenny for setting it up
Yeah.
and being patient, and thank you for your time. It was much appreciated, Dr. Todd.
Well, thank you, Karen. Thank you for your generosity.
Thank you for joining today's discussion with our divorce expert. Check out the show notes for more about our guest. If you're finding value in our podcast, follow us on Spotify, Apple Podcasts, and our YouTube channel at Divorce Workshop. Share your questions, comments, or guest suggestions. We'd love to hear from you. For a comprehensive divorce guide, check out our Just Separated workbook on Amazon worldwide. This workbook covers everything from emotions and co-parenting to finances, legal insights, and recovery, a must-have for anyone navigating separation or divorce.